My name is Madison and I'm an OTA student here at Penn College, and today we're going to be talking about different toileting aids. The first item I'm going to be demonstrating is a suppository inserter. So what is a suppository inserter? The use of the equipment allows an individual to stimulate and empty their bowels. Cost is approximately $79.99 and up. A suppository inserter is not reimbursed by Medicare. Spinal cord injuries such as a C1 through C12 resulting in quadriplegia or a diagnosis of cerebral palsy may benefit from a suppository inserter. A suppository inserter is beneficial to a client with a spinal cord injury because it has a D-ring hook and it allows an individual with limited hand function or poor grasp to insert the applicator in independently so that they may have a bowel movement. An individual diagnosed with cerebral palsy may have constipation and a suppository may be necessary so that they can have normal bowel movements. The inserter will allow the individual to be independent in their bowel movements. This equipment can be obtained online through the website Shop Catheters, or it can be obtained through the supermarket Walmart. The next piece of equipment we will be discussing is a catheter bag. As pictured here, a catheter bag is used to empty the bladder. A catheter is inserted into the bladder via the urethra. Cost is approximately $10 and up. Medicare will reimburse for 200 single-use catheters per month. A C6 or C7 spinal cord injury or a diagnosis of diabetes may require a catheter bag. A catheter is needed if an individual is unable to voluntarily empty their bowel or bladder, or if they have limited fine motor coordination, such as a C6 or C7 spinal cord injury. A diabetic client may have incontinence, and a catheter bag may allow them to void their bladder. This equipment can be obtained at a local pharmacy such as a CVS pharmacy or a Rite Aid. It can also be obtained through the supermarket Walmart. Next item we'll be discussing is the standalone commode. A standalone commode is a portable commode that can be easily folded up and moved. Cost is approximately $30 and up, and yes, a standalone commode can be reimbursed through Medicare if a client is confined to their room/bedridden and cannot easily access a toilet safely. A standalone commode allows a total hip replacement client to observe the necessary hip precautions advised by their physician. A COPD client may need a commode closer to their room due to decreased energy. If a client is confined to a room, a standalone can be used. This equipment can be obtained through the supermarket Walmart or the home improvement store Lowe's. Next, we will be discussing the Easywipe bottom wiper. The use of an Easywipe bottom wiper extends someone's reach, clamps paper or a wet wipe during bottom wiping, and releases soiled toilet paper. Cost is approximately $9.99 and up. Insurance does not reimburse for a bottom wiper because it is considered a convenience item. Populations requiring this specific equipment include rheumatoid arthritis, ALS, and even the obese population. If a client has poor grasp patterns, such as with RA, a bottom wiper can make wiping easier due to an increased grasp. An individual with poor postural control or weakness may benefit from an extended reach, and wiping aids can help with hygiene, skin conditions, and odor. A bottom wiper can be obtained online through the website Amazon, at your local pharmacy such as CVS or Rite Aid, and it can also be obtained through Walmart, and Walmart has a generic brand that is cheaper. The next toileting aid we will be discussing is a handheld urinal. They make both male and female handheld urinals. The one pictured is a male urinal. The use of the equipment is simply to collect urine. Cost is approximately $4 and up, and yes, a handheld urinal can be reimbursed through insurance because it is durable medical equipment and therefore reusable. Medicare will pay up to 80% of the cost, and cost is approximately $1 and up, depending if you buy handheld urinals in bulk quantities. Populations requiring this equipment include multiple sclerosis, CVA, cerebral palsy, and spina bifida. It could be needed if a client cannot safely use a toilet or if they are on the go. This equipment can be obtained online through a distributor such as Amazon, CVS, or Rite Aid. It can be obtained through Walmart as well. I will be demonstrating the Buckingham Easywipe and the standalone commode. So today I'm going to be demonstrating the Easy Bottom Wiper by Buckingham. It's actually designed by an OT. So it comes in a nice travel bag that you can take it anywhere, and it fits in this bag and it helps keep it discreet. So what you do with it is you can actually put in toilet paper or even a wet wipe. So it clamps right in here. Okay. So you put the toilet paper in here, we have a paper towel, and I'll demonstrate on this little guy. So basically what you can do is once you've wiped your bottom, you can actually throw it away once it's soiled and just put it in the toilet. So next we're going to be demonstrating the standalone commode. A standalone commode can be placed anywhere in the home. Most often they are placed in a client's bedroom. And what's nice about these is they can be folded up and moved because hence they are a portable commode. So what's nice about them is you can actually have a bucket and it comes out, and that's easier for if a caregiver needs to change the bucket to keep it clean. So you just take the lid off and you would dump it out, clean it, and it goes right back in. And it has adjustable features for height. So we'll have Charmin over here. He'll just, if he needs to, he can just use this right next to his bed. This item we will be talking about is the standalone commode, as right there.
Wait, do that again. I think my voice was in it.
Oh.
This will be cut out.
Wipe. Right.
I got a close up of you trying to do that, so you're gonna have to cut that out.
The diagnosis is in. So it actually comes in a nice travel bag, which is good if you're, what's it called? When it's not noticeable.
Universal, but that's like for home.
No.
Disguise?
Yeah, like it's disguised, like it's not noticeable. What's that word?
Unnoticeable?
Yeah.
Disguise.
I think it starts with a D.
A D?
I think it does. I'll look it up. It's like,